As we all know, knee is one of the largest joints in the human body, and this makes it one of the most vulnerable ones as well. The knee joint, as I describe it, is like a hinge where the knee can bend and straighten. And for this hinge joint to function effectively, in so much of demands we put on it, it's got ligaments which hold it all together. And there are also cushions inside the knee, we call them the meniscus. This entire intricate arrangement is very well balanced for all the demands or the activities we do over the knee joint. This is vulnerable to different kinds of pains and problems across the age group. It's right under the skin, so in children when they fall, it's the easiest one to get bruised and cause pain and discomfort. There are also some situations where some of these bones become very prominent in growing time because of excessive muscle pull, and those needs appropriate kind of rest and treatment. As we grow older and we are getting into sports of today, especially the competitive sports and contact sports, puts knees to a tremendous amount of stress, and there's a lot more expected out of it. This hinge knee, which we are meant to be walking straight, when we suddenly change our course and we are subjected to pulls and pushes in a game, we swivel on the knee, we turn, and sometimes we suddenly stop and jerk. These ligaments can get damaged during those acts. And now we come to one of the biggest aspects of knee problems, especially in women and in our country. As we grow older, various reasons, genetics, or maybe our squatting habits, the knee joint itself undergoes a lot of wear and tear. It degenerates. By that I mean the cartilage cap at the end of the bone, the thigh bone, the femur, the leg bone, the tibia, the cartilage starts wearing off. When that happens, the bones are bald and they rub against each other. This causes enormous amount of discomfort and pain. Because the two hard surfaces rub against each other, they produce debris. These debris get caught between the two bones. I keep describing this situation like the tire and tubes of a vehicle are gone and the vehicle is running on the rim. It's that kind of pain and pressure these bones are put to. Gradually, these bones also bend. You must have seen a lot of people at older age walking with bow legs. This is typically what happens, and we call that osteoarthritis. This is almost an endemic proportion of people undergo this. We are living much longer than ever before, and as we age, there is degeneration, and this causes tremendous amount of pain, discomfort, and compromised lifestyle. In fact, they gradually give up socializing, gradually give up their walks, and pretty much get confined to their homes. If this knee gets damaged, obviously one needs to know what is damaged, and today we have very advanced investigations to know what is damaged, and absolutely appropriate treatment at the appropriate time is the key. If one subjects a damaged knee to further strain and stress and activity, it's only bound to make it worse. So one has to understand an early diagnosis, knowing what exactly has gone wrong with the knee gives us a lot of advantage in protecting further damage. Fortunately, there are solutions available for this today. We can cure this pain. In initial stages, we do a lot of physiotherapy, slight change of lifestyle, but ultimately, if this doesn't get better at all, we undergo, or we put, as doctors, we recommend and do knee replacement surgeries for these people. And that gives an absolutely phenomenal result with which they can reclaim their life and get to normalcy. To conclude, there are many reasons for the knee pain, but one needs to identify specifically why the knee is hurting, and the treatment has to be tailored to that. It's very easy to overdo or underdo treatment in knee. So the precise diagnosis is the key to take care of any knee problem, right from children to old age. Thank you.